Alrighty, we're going to go ahead and get kicked off. Again, thank you for joining us today. My name is Erin Malone. I'm a benefits analyst with the Human Resources team, and I'm joined by my colleague, Jessica Fetters, who's one of our amazing benefits administrators. We're going to share with you today a benefits overview for faculty and administrative professionals and other non-classified staff to really highlight the benefit plan offerings available for 2026. So one of the first questions we often think of when examining benefits is when can you enroll? Enrollment is restricted to certain periods, including new hire enrollments, open enrollment, or mid-year qualifying events. New hires receive a 30-day enrollment window from their date of hire to enroll in benefits when they first start employment with the university. If they don't enroll during that time, you are only able to enroll during open enrollment or a mid-year qualifying event, which is something like a life-changing event like a marriage, birth of a child, loss of other coverage, things like along those lines. Open enrollment for our faculty and administrative professional group is typically held in November for a January 1st effective date. This year it is coming up starting next Monday, October 27th, and will run through mid-November. Our plan year for faculty and administrative professional employees follows the calendar year, so that plan year runs from January 1st to December 31st. And how to enroll. Currently for this year's open enrollment and any new hires or life changes through the end of this year, you will enroll using the employee self-service portal through our Oracle Advanced Benefits system. But beginning in 2026, we will be rolling out the Workday system for our human capital management system. So benefits enrollments are going to occur in that system, which is really exciting. We're super happy to uplift that program and make sure it's going to be a much more simplified process for employees as far as enrollment. So keep an eye out for more information about that coming soon, because that'll be starting in 2026. The university is pleased to offer a comprehensive suite of benefits, including core benefits. So these are benefits that are fully employer paid that we offer to faculty and administrative professional employees. The first would be $70,000 of basic life insurance, and also short-term and long-term disability and employee-only medical coverage under the RAM plan. We also offer voluntary benefits that employees can opt into, including medical coverage for dependents or medical coverage on the plans other than the RAM plan, dental, vision, voluntary life insurance, accidental death and dismemberment, accident, critical illness, hospital indemnity insurance, flexible spending accounts, and health savings accounts. We're going to cover all of these in more depth in later slides in this presentation, but you can also use that QR code on the screen there to visit the landing page on our website for the benefits programs. We're going to start with talking about medical insurance. I know this is kind of one of the big ones, so we will spend quite a bit of time here covering these plans. The university does offer 4 medical insurance plans for our faculty and administrative professional staff. The RAM plan, which is the high deductible health plan with an HSA, the green plan, which is a deductible and co-insurance plan, the Aggie Orange plan, which is a hybrid plan that includes co-pays, deductibles, and co-insurance, and the Colorado Pathways plan, which is also somewhat of a hybrid plan using an EPO network available only to employees in Colorado. I do want to highlight that coverage for employee-only coverage on the RAM plan is fully employer paid. So employees that enroll in that plan don't have a monthly premium cost. It is fully covered by the university. The administrator for these medical plans on behalf of CSU is Anthem Blue Cross Blue Shield. They do have a nationwide network with the exception of that EPO network, which we'll talk about a little bit later as well. But you're able to access care just about anywhere on the other network. Before we jump into talking about the plans in more depth, it's helpful to do kind of a refresher on the key terms and how they all interact. It's important to understand all of these as you're navigating medical insurance and what might be the best fit for you and your family. Premiums are the cost per month for coverage. So this is what kind of a flat amount that you pay for the plan. CSU does utilize a cost share model where the university covers the majority of most premium costs for employees, and then employees, depending on the level of coverage, may also have a out-of-pocket expense for the premium that is deducted from your paycheck. The deductible is the amount that you pay out of pocket before insurance begins covering costs. So on those deductible plans, if your deductible is $1,750, you are going to pay that amount out of pocket potentially before you start receiving a higher level of coverage. The exception to that is that preventive care is fully paid right from the get-go across all the plans. So this is really the deductible applies more in cases of illness or injury. A copay is a fixed fee for a service. So those are negotiated within the plan. So let's say, for example, you have a $40 copay for a specialist visit. You're going to pay that copay every time you receive that service. Coinsurance reflects your share of costs after meeting the deductible. So this is after the deductible. If you have paid up to your deductible, then co-insurance kicks in. So at that point, the plan might cover 80% of costs and you're responsible for 20, and that's where that co-insurance is. The out-of-pocket maximum is the most that you will pay in a plan year before insurance covers 100%. So that's if you've met your deductible and then with your 20% co-insurance, you have paid out of pocket up to a certain amount. That's your out-of-pocket maximum. Then the plan will cover fully after that. So that's really kind of a little bit of a safety net in a worst case scenario where you have a really expensive year, you do have a maximum out-of-pocket maximum that you would reach. The first medical plan that we wish to discuss today is the RAM plan. This is our high deductible health plan. So on this plan, the deductible must be met before services are covered, again, with the exception of that preventative care. The deductible includes both medical and pharmacy costs, so it doesn't matter whether you are going to pick up a prescription or you have a visit to urgent care, anything you're paying out of pocket is going towards that deductible. Costs for any covered member on the plan accumulate towards a single overall deductible as well. So it doesn't matter whose expense on the plan, if you have dependents, it's going towards that one overall deductible. And really the highlight of the RAM plan and a great feature is that it is our only medical plan that is compatible with the health savings account. And I'll touch on the health savings account in just a moment here on a future slide, but that is really something to highlight on this plan particularly. And you'll see on this slide, we have our premiums and deductibles listed. So those monthly premiums, as I mentioned, the employee only cost is no cost for the employee. The university does cover that full premium cost. And then depending on who you're covering, if you have spouse, partner, children, the cost does go up from there a little bit as far as the monthly premiums are concerned. These premiums reflect the amount that employees pay for these plans in 2026. You'll also see the family split plan option. What this is if both employees are a spouse partner are both benefits eligible employees in the faculty or administrative professional group, they can enroll in this family split plan. One employee will carry the family coverage, so you can make the decision amongst yourselves who wants to enroll the family in that plan, but they do receive a higher employer contribution to that family split coverage. For deductible, you'll see here the deductibles are broken out by individual and family, as well as in-network versus out-of-network. So on the RAM plan, you can go out-of-network for services, but you do need to be aware that you have an out-of-network deductible that is separate from the in-network, and those two do not cross-accumulate. So you have the two separate essentially. The individual deductible on the RAM plan is $1,750, and then the family is $3,500. After that deductible is met, the coinsurance is an 80-20 split where the plan pays 80% and employees are responsible for 20% of the costs up to that out-of-pocket maximum that we discussed. For the health savings account, this is kind of really, again, a highlight of the RAM plan is the access to this health savings account. What the health savings account does is allows employees to set aside funds on a pre-tax basis to pay for healthcare expenses. This is administered by Fidelity Investments on behalf of the university, and the university does contribute $500 annually to that account to help offset that higher deductible on the RAM plan. The $500 contribution is prorated by month to provide a greater level of support across the year, so you do have a monthly contribution. As well as the university contribution, employees are also able to contribute their own money to this account on a pre-tax basis, having some cost savings, tax savings there, up to the individual or family maximum, depending on your level of coverage. And these maximums are set by the IRS. So for 2026, individuals may contribute up to $4,400 to the HSA, and family may contribute up to $8,750 to the HSA. Individuals over age 55 are also eligible for up to $1,000 in catch-up contributions. It is important to note that when you are calculating what you would like to contribute to the HSA, the $500 from CSU does count towards that overall maximum. So you would need to reduce your own contributions accordingly to make sure that that $500 is factored in. Another really great feature of the HSA, though, is you can change your contributions at any time throughout the year. So if you start one way at the beginning of the year and you realize later you need to increase or decrease those contributions, you can certainly do that just by contacting Human Resources, and we can guide you through. And you also can roll over the account balance from year to year. So if you end up with money at the end of the year that you haven't spent on healthcare expenses, it just rolls forward. Next, we want to cover the Green Plan, which is the second medical plan option offered by CSU. The plan is similar to the RAM plan in that it also is a deductible plan, but there are some pretty significant differences in how the deductible is structured that make this plan unique from the RAM plan. The main one is that medical and pharmacy costs have separate deductibles within the overall deductible. So for example, if you have a routine prescription you're picking up, that is going to accumulate towards your pharmacy deductible versus your other overall deductible. Additionally, costs for each member on the plan accumulate towards an individual deductible within the family deductible. I'll give some more examples of that and how that actually looks on the next slide. So you'll see here the monthly premiums for the Green Plan. They are fairly comparable to the RAM plan with some exceptions. The deductible is a little bit lower, and you'll see there that split I was mentioning between the pharmacy and the overall medical deductible. So on this plan, if you are, for example, an individual enrolled in the plan and you're picking up a prescription, the cost of that prescription is going towards your $200 pharmacy deductible. Or if you go to your specialist, to a specialist visit, that is going to accumulate towards that $1,250 deductible. So those are separate. And then as I mentioned with the kind of individual deductibles within the family deductible, let's say you have yourself and 3 children covered on the plan and you have that family deductible of $2,500, but one child has gets into some kind of accident and they have enough costs that they meet, you've paid up to $1,250 out of pocket for their expenses. That individual then begins receiving co-insurance on their expenses, so 80% coverage on theirs, whereas the rest of the family, so you and your remaining dependents, are going to keep making up the remainder of that family deductible. And similar to the RAM plan, 80% insurance, 20% employee after the deductible is met. All right, Colorado Pathways Plan. So this plan is a hybrid plan, as I mentioned previously, with some services subject to copays and other services subject to deductibles. So on this plan, a lot of your more frequent services are going to be a copay structure, whereas more major services are subject to a deductible. This plan operates within a highly streamlined exclusive provider network, or EPO network. So it is a very specific network for this plan, and it is only available to employees within the state of Colorado. So that is very important if you're considering the Colorado Pathways as an option. Make sure to research that network to confirm your providers are in network. We have a listing available on the HR website of in-network providers throughout the state. So that's a really critical piece if you are considering this plan, to just make sure the doctors that you see and have a relationship with are in that network. On this plan, copays and deductible services both accumulate towards out-of-pocket maximums as well. So here you have some examples of what those copays might look like, as well as the deductibles and the monthly premiums. You'll notice the monthly premiums are a little bit more on this plan, and that is because you are paying a little bit more out of pocket for the monthly premiums to hopefully have more predictable costs when you go to the doctor with those copays. So with the copays, this is just a couple. There's a bunch. You can definitely use that QR code to visit the plan document and see a more comprehensive list of copays, but we wanted to provide a couple examples here of a primary care physician visit other than preventative care. That's going to be a $20 copay. Specialist is $30. Tier 1 prescription for a 30-day supply would be a $10 copay. So that's, again, kind of that flat fee that you would pay when you obtain those services. And then for those more major services that are subject to deductible, you see those deductibles there for the individual and the family. There is no out-of-network deductible on this plan because there is no coverage out of the network. Coverage outside of the EPO network on the Colorado Pathways plan is really only going to be for emergency situations. So that's very important to note as well. All right, and finally, last but not least, we have our Aggie Orange plan. Again, this is a hybrid plan with some services that have a copay and some that have deductibles. The copays and deductibles both accumulate towards your out-of-pocket maximum, which is nice. So everything you're spending is going towards that out-of-pocket maximum on these two plans. Copays on the plan only apply to in-network providers on the Aggie Orange. So the Aggie Orange, you can get services out of network. It's not like the Colorado Pathways or it's only in-network. But if you do go out of network on this plan, the copays won't apply. You're going to be paying towards the out-of-network deductible. All right, and again, you see the premiums there. Similar to the Colorado Pathways, a little bit more on the premium side to have more predictable costs when you actually go to obtain services. The copays there, again, just some examples of what you would expect to pay as your kind of flat fee for those types of services. $40 for that PCP visit, $50 for a specialist, or $10 for a tier 1 prescription 30-day supply. And then those deductibles there, again, you have that in-network, out-of-network deductible, also broken up by individual versus family. And similar to the other plans, the deductibles do not cross-apply. So again, if you need to go out of network, you can, but you aren't going to have copays and you will have to, you will be accumulating towards that out-of-network deductible. On this plan, the coinsurance is a 25% coinsurance after the deductible is met. So employees will pay that amount after deductible. We're going to pause there. That was a lot of information. So I didn't mention this at the beginning, but if you do have questions, please drop them in the Q&A function and we'll be checking that now. And then we'll stop again at the end for questions as well. So Jessica, did any questions happen to pop into the chat?
So one of the questions is the HSA catch-up contribution for those that are only age 55 or older than 55?
Age 55 and up. Yep, so it does include if you are 55 this year.
Cool, thank you. And then I think one more great one to kind of highlight during this presentation is what happens when an employee turns 65 with medical insurance through CSU?
Yeah, that is a great question. And definitely a pretty loaded topic, but you have a couple options of what you can do. You can stay on our CSU medical insurance plans and defer your Medicare enrollments because we are a qualified employer health plan that allows you to do that. So if that's something you would want to do is just stay on CSU's plan and defer Medicare enrollment until you retire. That is an option. You can enroll in both. Our plans do run primary to Medicare. Or if you decide you just want to get on Medicare and drop the CSU plan, just notify us as soon as you know you're planning to do that so that we can help walk you through that mid-year qualifying event. But lots of options of what you can do. So if you do have more specific questions for your situation, please don't hesitate to contact our team and we can definitely talk through that with you on a more individual basis.
Cool. Thank you, Erin.
Yeah, of course. All right, is that all the questions for now?
Yeah, there are a couple others in there, but I think we can address them moving forward.
Perfect. All right, that sounds good. Then I will hand it over to you.
All right, thank you. So in addition to all of the medical information that Erin was just discussing, another great resource that's available through Anthem is the Sydney app. You can download it using that QR code listed at the bottom of the slide. It will route you to the App Store where you can just download it conveniently. And this tool is a great resource to use throughout the year. It could be used for finding where you're at currently with meeting your deductible and out-of-pocket maximum. You can also view and select from various different health programs to get ahead of your health and well-being before any problems arise. And it also is a great resource to view your medical ID card, so you don't have to have one physically available in your wallet. So you can have it just accessible on your phone. And then you can also complete challenges throughout the year to earn rewards like gift cards and things like that. And then now that we have a grasp on all of the medical plans and Anthem's resources, we can now chat about the dental coverage options that are available. And there are two plans that employees can pick from to enroll in, the Dental Basic and the Dental Plus plan. There are a few different differentiators between the two plans and what sets them apart. The basic plan is nice in the sense that there is a freedom to use any dentist of your choice. It is not locked to any specific network where you have to search to find whether or not the dentist that you're using or that you like to use is in that network. And then another differentiator is that it's a reimbursement style plan. So when you are using that plan, you would be asked to pay for the services, the cost of the services up front when you go to your dentist, and then you can file a claim with Delta Dental afterwards to seek reimbursement. And 100% of the first $100 of that claim is reimbursed, and then any cost over $100 is reimbursed at 50%. There is a maximum reimbursement amount per plan year of $1,000 as well. And then the difference between the Plus plan or the benefits of that is that it does have the Delta Dental PPO network. And if you go to their website, you can search dentists that are in the Delta Dental PPO network to see if your dentist falls under that category. If your dentist is not in that network, there still are discounts for using this plan. The most discounts are through that PPO network, however. Another benefit is that it has twice the amount of maximum allowance under that plan of $2,000. And there's also a $50 deductible in co-insurance after the fact. So there is a little bit less out of pocket that you would be spending for using services. And it also covers orthodontia, and there is a $1,800 maximum per lifetime benefit per user on the plan for orthodontics. And the premiums are listed below. And similar to the RAM plan employee-only coverage, the Delta Dental Basic plan for employee-only coverage is also $0, where CSU is covering that full cost of those premiums for you. And I think we're ready to talk about vision. Perfect, thank you. So with vision, the nice thing is that there's one plan to pick from, so it makes that choice super easy. And if you do visit that QR code on this slide, it will get you to the information about vision coverage. It is administered through VSP, and there are some perks to using this plan to make regular things like your eye exam, basic lenses, and frames more affordable to users of this benefit. So the eye exam, as listed, is $40 for the copay, and then lenses are $25, and there is a $175 allowance for frames every 2 years. And the premiums are also listed at the bottom of the slide there as well. All right, and so life insurance, as of 2026, the administrator for the life insurance plans will be moving to Sun Life, and all employees that are benefits eligible at CSU will be enrolled into the basic life plan that has $70,000 worth of coverage, and it is free to CSUs or CSU employees. So CSU is covering that full cost of those premiums. If you so choose, you can add additional life insurance plans as well. There is voluntary term life with a maximum of $500,000 of coverage. You can also add spouse life of up to $300,000, and then child life has a flat set amount of $20,000. And there's also AD&D or accidental death and dismemberment available as well. One cool thing with this switch to Sun Life, and for a one-time chance only during open enrollment, you can select up to $250,000 of coverage for the voluntary term life or $50,000 for spouse life or a combination of both without having to complete the evidence of insurability or underwriting process that is involved with increasing your life insurance amount. This is only available through open enrollment, so it's a pretty exciting time to be able to take advantage of that. So for the flexible spending accounts, the FSAs, those are available for all the plans except for the RAM plan, with a exception again to the dependent care FSA. There are two different accounts that you can set up through CSU, and it is the healthcare FSA or the dependent care FSA. And then the maximums available for these two are also set by the IRS. And this coming year in 2026, it's going to be $3,400 for the healthcare FSA. And then we're having a big jump for the dependent care FSA of $7,500. And these contributions are pre-tax, so it does lower the taxable income that you have per month and also per year for an additional extra savings there. One big difference between the FSA and the HSA is that contributions do not roll over year after year. So when you are determining what contributions you would like to have for these accounts, just make sure you do keep that in mind. And then also, if you do enroll into the HSA with the RAM plan, you can have the dependent care FSA. However, if you do enroll into the RAM plan, you are not able to also have the healthcare FSA. And then there are a couple options for additional supplemental coverage through the Hartford. And those plans are the accident insurance, critical illness, and hospital indemnity. These plans provide a cash benefit for out-of-pocket expenses from emergency types of situations. The critical illness also has two different tiers of coverage to choose from when you are enrolling. And then in addition to those supplemental plans, the Hartford does provide extra resources to help navigate hardships that life can bring. The empathy section does provide grief support for beneficiaries. There is also counseling for emotional and work-life balancing and resources available for financial assistance as well as legal support. There is also assistance available to navigate healthcare options. So perfect time for open enrollment if you want to speak with somebody to help determine which plans are best for you. You can get that done through the Hartford. And they also provide a $75 cash benefit for those preventative care screenings if you are enrolled into the accident or health or hospital indemnity insurance plans. And then here at CSU, because we do not contribute to Social Security, all of us have a mandatory retirement account that we are automatically enrolled in. Many of us are enrolled into the Defined Contribution Plan, or the DCP, with Fidelity, and there is a flat locked amount of 8% of the employee contribution, and some employees are also eligible to receive a 12% contribution of your gross wages to that account as well from CSU. And then in addition to the mandatory retirement plans, there are a couple other additional voluntary retirement accounts that you can open. There is the CSU 403B that's also administered by Fidelity, a 401k, and the 457 that is administered by Para. You can enroll into and change your contributions to these plans at any point throughout the year. It is not locked to open enrollment alone. And there are maximums, just like with the HSA and the FSA, on how much you can contribute to these accounts, and these maximums are determined by the IRS. And then you can also change whether or not you want these contributions to the 403B, 401k, and 457 to be pre or post-tax. And you can kind of pick and choose different ones. So if you want to do pre-tax for one, you can do post-tax for another, and so on and so forth. Also, if you are enrolled into the Fidelity DCP mandatory retirement plan, you can still have the 401k and 457 with Para as an option too. And then CSU understands the importance of well-being, and there are many resources available to employees for helping with different other things about life. The Wellbeing Hub can be accessed at bewell.colostate.edu or by scanning that QR code at the top corner as well. And there you will find information for free coaching sessions through ComPsych and other resources for families, financial and legal items, and others around the community. So Fabiana is our amazing EAP coordinator. She is also located in the HR building that is located off of House. She can assist with navigating the resources that are available through the Wellbeing Hub and also how to access or use those resources as well. And as mentioned, ComPsych is our administrator for a lot of other EAP things, such as the coaching sessions. And that phone number of 1-800-497-9133 is available to use 24/7. So if you do have a crisis in the middle of the night, you are still able to reach out to them for help. And as just a little side note too, this presentation is just a summary of certain key benefits through CSU and is not all encompassing. And if there is an event of a conflict between this information and the official plan documents, the plan documents would still govern. Since this is just a quick summary of some key benefits, more information and details can be found on our website and on the summary plan description. And I think at that time, we'll open it up for more questions.
Awesome. Thanks, Jessica. I appreciate you sharing all of that. Looks like we do have a couple of questions in the chat. We had an individual wondering where can they find the out-of-pocket maximums for the medical plan?
That is a great question. On our website, we do have a couple different quick places to find it. There is a medical comparison guide on the open enrollment section of our webpage and also through the benefits section too, if you navigate under the employees dropdown. And it's also located on the summary plan description.
Awesome. Thanks, Jessica. We had another attendee wondering, are there copays or what are the copays for specialists if they are on the RAM plan?
There are no copays with the RAM plan. If you are looking for a plan that has copays, the Aggie Orange or the Colorado Pathways would be the best bet. Since there are no copays with the RAM plan, that does mean that outside of preventative services such as your annual checkup, you are asked to pay for the full cost of those services until you reach that deductible, and then the coinsurance would kick in.
Awesome. And then we did have a question about the Delta Dental insurance specifically, if the calendar year maximums are dependent on for each person on the policy or overall, regardless of how many dependents are on the plan.
That's a great question. Correct me if I'm wrong, but it is for each individual on the plan, right? Cool. Yes. So if you and your family are on that plan, it is each one of you, if you're on the basic plan, would have $1,000 maximum available for that reimbursement.
All right, and we do have another question. Do I have to enroll in healthcare through CSU or medical insurance through CSU in order to get the additional insurance options such as dental or vision?
Oh, that's a great question. No. So it is a la carte. You can pick whatever plans that you would like to use. Um, so I hope that helps.
Awesome. And then we had some questions about retirement as well. Who is eligible for the 12% contribution to retirement, or how do you become eligible?
So that's it depends on your employee type at CSU. So if you are contributing to the DCP and if you are a special or regular assignment, you will have that 12% contribution already added on as long as you're working more than 20 hours per week. So if you're working less than 20 hours per week, regardless of the employee type, you will not be eligible for the employer contribution. Temporary employees have to meet 12 months of service before they are eligible for that employer match as well. It is something that happens automatic too, so there's no action needed on the employee's end to initiate that change.
And continuing in that same vein of retirement, is the DCP only pre-tax contributions?
The mandatory retirement accounts for the DCP is only pre-tax, so those are locked. We cannot change those contributions. But another perk to it is that it lowers your pre-tax income, so less money going to taxes.
Awesome. Thanks, Jessica. And we do have some questions kind of jumping back and a little bit to the medical plans. We did have a question about, does the EGI plan cover out-of-state and international travel medical costs?
It does cover out-of-state costs, and I think for international, it kind of varies on what they would cover. Anthem also partners with GeoBlue, so if you do have any services that are needed out of the country, you can coordinate with GeoBlue to get services paid. I don't know if all services are covered, though.
Thanks, Jessica. And we do have a question regarding adding a domestic partner to insurance and what are the requirements to cover a domestic partner?
Great question. There is a two-step process for that. You would have to complete an affidavit for domestic partnership, and this affidavit would also need to be notarized. We do have a notary in our service center, and they are available by appointment. If you are planning to use our service center, please note that both you and your partner will need to arrive together to get that completed. In addition to the affidavit, we also need to have a joint financial document. It could either be 1 or 2 pieces of mail, just needs to have both of your names at the same address and within the last 60 days. So if you have like a mortgage statement or different bills that you're splitting up utilities or other insurance like car insurance things, that would work.
Awesome. And we've had several questions about the availability of these slides after the meeting. And I also wanted to mention that this actually has been recorded and we're hoping to make it available on the Human Resources website. So you will have access to revisit the recording if you have anything you want to revisit, any questions. So that is going to be available to you all. And then we did have some questions, Jessica, if you want to speak to retirement. Again, we're kind of bouncing all around here. What happens to your DCP account after you leave employment?
That's a great question. So there is a 45-day waiting period after your last day at CSU before that account is released to you. And it is, since it's administered by Fidelity, you can work with a Fidelity rep to determine if you want to roll it over, roll a different account into that account, or start, if you are of retirement age and want to start drawing from that, you can also work with them on the nuances and how to get that done too.
There is a question about life insurance and what happens to that when you retire, if you can speak to that a little bit as well.
Sure. Life insurance has the option to be portable. So after you retire or leave CSU, that plan can carry with you. Sun Life next year, or this year it is the Hartford, they would reach out to you within 30 days from that last day of work at CSU, and give you instructions on how to get that transferred into your name instead of it being through CSU. Since as an employee, those premiums are pretty low, there is a chance that those premiums might increase when you do switch it over in your name, but it certainly is portable.
Awesome. And we do have a question about family split enrollment, which I can speak to. Family split enrollment is changing just a little bit for 2026. How the plan has been administered in the past is that each spouse or partner enrolls kind of on their own account under that family split coverage, but next year, just one or the other, you're going to choose between the two of you who you would like to carry that family coverage. Family split premiums are still going to apply where you have the higher employer contribution, but it's just going to be on one person's account, which should hopefully simplify things a lot for folks in those plans. Um, it is a passive enrollment, so if you don't take any action, there's a default procedure where it's just going to roll over to whoever is currently the primary subscriber on that plan. It's going to just take the family coverage on their record. But if you don't want that to happen, if you prefer that the other spouse or partner carries the plan, you do need to take action during open enrollment to change that. And we will be sending some communications to our employees enrolled in that family split plan to let them know about that. So you don't have to take action if you don't take any action. There will be a default process where you'll still have the coverage and the family split. It just will default which spouse or partner carries that coverage. So if you don't want to go through that default process, then yes, you do need to take action this year for open enrollments. Otherwise, it'll just default into that according to the way the system plan rules are set up. All right, there is another clarifying question about that family split coverage. Will the primary then on the family split pay the entire amount for the family? Yes, that is correct. That premium amount's no longer going to be split between the two paychecks. It's just going to be whoever's primary is going to have that family split premium taken out of their check. Again, it's still lower than the regular family premium because of the family split option. You do get more employer contributions, so you still will be paying less overall, but it's just going to come out of one person's paycheck instead of dividing between the two. All right, there is a question about, can I sign up for CSU employee health insurance if I did not enroll when I was originally hired?
Yes, you can. So even if you waive coverage in the past during open enrollments or one of those other mid-year life qualifying events that Erin mentioned earlier, you're more than welcome to enroll at that point in time. It looks like one more question trickled in. When you leave CSU, how long is your health coverage active?
Yeah, that's a great question. So coverage is active through the end of the month in which you leave CSU. So there's always going to be a little bit of a grace period even if you leave mid-month, it'll run through the end of that month.
Here's another one. If I just enrolled as a new employee within the last 30 days, do I have to re-enroll with open enrollment? Or can I use this as an opportunity to pick different options?
Yeah, great question. Either or, if you're happy with the selections you've made as a new employee and you don't take any action, your current enrollments will roll over to the next year. The only exception to that is flexible spending accounts. So if you are enrolled in one of those flexible spending account or dependent care flexible spending accounts, you need to make sure to re-elect that for the coming plan year. Otherwise, if you want to explore options or maybe choose something different, you can definitely do that as well. So up to you, whatever is suits your needs the best. All right, I don't see any other questions. Jessica and I will hang out for just a couple more minutes in case there's any more. But again, really appreciate you all joining us today and taking time out of your day to learn more about the benefit options for 2026. If you do have questions, our team's always happy to help. We have a lot of opportunities for assistance coming up. We have help sessions that you can sign up to meet one-on-one with a benefits representative, or you can always give us a call, send us an email. You don't have to schedule a help session. We're always available to help you during business hours. So feel free to call us or email us using that contact information on the screen, and we're definitely here to help you as you navigate this open enrollment and benefits, and all of this can be a pretty weighty topic, so just let us know how we can support you all. All right, well with that, I think we will wrap it up. Thank you all again, and have a fantastic rest of your day.